Good morning, everyone. Welcome back to the UBC Learning Circle, hosted by the Center for Excellence in Indigenous Health. We are very excited today to be partnering with the Indigenous Research Support Initiative once again for the second part of our collaborative series. IRSI, for those of you that don't know, IRSI provides support and services for Indigenous communities and UBC researchers engaged in collaborative community-driven research. And they've also been an instrumental player in bringing this series of conversations to the Learning Circle. So our hands go up to IRSI for their involvement here. We are both happy and excited to welcome Doctors Steph McLaughlin, Merle Ballard, and Ramona Nekaway. They're part of an Indigenous-led initiative that's examining ways that healthcare systems and services have responded to the needs of First Nations communities during health emergencies and pandemics out of, I believe it's the University of Manitoba. But they'll kind of talk a lot more about their project, and I'm really excited to learn more about it. So before we begin, I would like to acknowledge that the Learning Circle is based on the traditional, ancestral, and unceded territories of the Coast Salish peoples, Musqueam, Squamish, and Tsleil-Waututh. That's where I'm coming at you today. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So kind of a brief trigger warning here before we jump into it. The topics we cover can sometimes be sensitive or emotionally triggering, I think, particularly for this conversation today. Take extra care and make sure you're looking after yourself. So if at any point you feel like you need to talk to a friend or an elder, counselor, family member, whatever that support system looks like for you, please don't hesitate to do so. So brief introductions before we get started. In case you didn't know, my name is Cole. I'm from the Chowthil First Nation, and I'll be facilitating the discussion today. Other Learning Circle team members in the room, digitally, are Cynthia, our production coordinator, and Kaylin, our assistant coordinator. And joining our team behind the scenes today from IRSI are Julie and Emily. So if you feel so inclined, to see a few people have already done it, but if you feel so inclined, please introduce yourselves in the chat box as well. With that, I think I'll pass the mic over to our collected doctors here. If you wanted to introduce yourselves. Let's start with Steph.
Oh, okay. Hi, good morning, everyone. I'm Steph McLaughlin. I'm a prof at the University of Manitoba in environmental sciences and studies. And so I'm one of the co-leads on this project. And I've been working at the University of Manitoba for the last 20 years around issues related to environmental justice and health equity, social justice, especially with Indigenous communities and across Northern Canada. And so it's great to be here.
Great, thanks, Steph. Ramona?
Hi everyone, my name is Ramona Nekaway. I am from Northern Manitoba, and I just want to say thanks. Thanks. I'm grateful to be able to participate today and thankful to the organizers for pulling this event together. Greetings from Treaty 6 territory, where I am speaking from today, but I'm going to focus a lot of my conversation on what's taking place and some of the really interesting initiatives we're working on in the territory that I come from, which is Treaty 5 in Northern Manitoba. So I teach at University College of the North on their Thompson campus, and I'm with the Aboriginal Northern Studies program and happy to be here, and that's me.
Great, thanks, Ramona. And Merle?
Yes, thank you. Good morning. My name is Merle Ballard, and I'm a Anishinaabe from Lakes Martin First Nation. I'm from the Treaty 2 territory, and my affiliation is with the University of Manitoba. I'm with the Department of Chemistry, the Faculty of Science, and I'm assistant prof. And my background is on water management, flooding, displacement of First Nation communities. I'm doing, looking at frameworks for aquatic management system and mainstream science. And I have a lot of interest in the environment and and the natural resources. And I'm glad to be on this panel as well.
Fantastic. Thanks, everyone. So without further ado, why don't we just jump right into the PowerPoint?
Okay, I guess I can get going. So basically, we're going to be spending a lot of today talking about this project that the three of us are co-leads on, which was recently funded by CIHR, so the primary health agency that funds research in Canada. And we'll be talking a lot about our activities, the need for this kind of work, and some of our ideas for moving forward. And while we'll be spending about half the time talking about our project and all the things that we're involved in, obviously we're excited about sharing some of these ideas and getting feedback and kind of having a discussion really about other people's perspectives and views around these topics, and whether it's how we can kind of do things differently or better moving forward, or other kinds of people's activities around similar issues that are here today. It would be great to hear everyone's voices. As we've been saying, our project is Indigenous-Led Planning and Responses to COVID-19. I think it's important to recognize that two of the elders that we work with and kind of that are from northern Manitoba are Phyllis and Donald Hart. They came up with the Cree term Kitatipithitamak, mithwayawin, which means indigenous control or indigenous-led approaches to health and well-being. And that was a really important frame right from the beginning when we were just getting going on the project. And we were writing the proposal because it's all grounded in this idea that those should be the primary voices, kind of not only shaping our project, but shaping these kinds of activities moving forward. And then obviously we're the three co-leads here today. If you can put the next slide, that would be great. Cynthia. The goal has evolved a little bit, but basically what we did is we took a kind of a three-phase approach to the work that we're doing, learning from the past, really kind of exploring and doing what we could do to support communities in the present, and then also looking forward into the future to figure out how things could change, what could be done better to serve Indigenous communities across the country in dealing with COVID-19, other pandemics, obviously looking into the future, and more generally speaking, supporting communities more broadly around health and well-being. Next slide, please. And so in this case, what you can see here, and there's a number of these objectives that were just copied from the proposal, is in part, again, learning from those past experiences. And as many people here know, that there hasn't been enough work done in learning from the past, and a lot of these experiences are located in living memory within the communities. And so doing what we can to share those and to document those in ways that are accessible not only to academics and to researchers, but obviously to Indigenous communities across the country and the public as a whole when that's appropriate. We also wanted to play a role in the present in terms of helping communities kind of assess their own initiatives around emergency planning, if it was relevant to communities, inventories around supplies and access to health services. And then we had this idea that we could then spend time within the communities, working on building bridges between communities and kind of outside agencies in terms of making more relevant, effective, accountable planning around those things. We put a lot of work in the original proposal just around how we might better kind of envision what the future holds through workshops and through visioning exercises. And of course, COVID-19 hit us very early on. And so this proposal was submitted in mid-February, and it was very clear that the whole landscape had changed. And our role as researchers had to fundamentally change in that regard. And so a little bit of the context that I'll be talking about is the nature of those changes. And while we're doing a lot of kind of high impact and relevant work, our whole approach had to change in ways that I think none of us across the country had anticipated, just because of all the uncertainty and all the surprises associated with this pandemic. Next slide, please. We are all three of us grounded. I mean, Ramona right now is located in Saskatchewan, but we're kind of ground most of our work and our connections within Manitoba. But what you'll see is that in many, many cases, we're trying to also highlight and amplify voices, other parts of the country, and for that matter, other parts of the world. But you can see in Manitoba, as reflected in this in this slide here, that there are First Nations that are scattered from the very southern parts of the province right up to the kind of the subarctic along Hudson Bay. And next slide, please. So again, in terms of writing proposals, you have kind of these tidy little maps in terms of what you're going to do, and to convince reviewers that kind of you've thought these things out. Again, a lot of these core activities, whether it's documentation, content analysis of existing documents, interviews, potentially surveys, mentorship of students, outreach, knowledge exchange, these kinds of activities that we're doing today, for sure, advocacy and setting up for at the regional and the national level are all there still as core activities. And but again, we've changed things moving forward. Next slide, please. An important part of what we're doing is we only had a week to 10 days to put this proposal together. It was the CIHR, again, the Canadian Institutes of Health Research, came up with this idea of a rapid response call, where they would call researchers across the country in a very, very short time frame to put together proposals, either around the biomedical aspects of COVID-19 or the social and the policy aspects of COVID-19. And so kind of hundreds of researchers and research teams across the country submitted these. And that really didn't allow for a lot of engagement. But what we were able to do through this group that we're part of, called the Waniskatan Alliance of Hydro Communities, was to use our existing network with communities and with regional tribal councils and even health authorities to come up with a proposal that was really kind of accountable and engaged right from the beginning. And one of the primary ways that we're doing this is through this process of an advisory council. And so this advisory council will meet 2 or 3 times a year, and it'll provide overall direction and really help shape the priorities of the project, as well as giving feedback on tools and reportings and other questions, sometimes as a whole council and sometimes individually when we reach out to people. And what you can see here in terms of this list is that there's representatives from communities as health directors, from tribal councils in Manitoba and Northwestern Ontario, kind of a Northern Health Authority, a number of different regional Indigenous organizations, Anishinaabe and Cree elders, the 3 of us, and a project coordinator. And the idea would be this would be kind of a sounding body, if you like. And so very early on, we had our first meeting within a month of getting the funding. And that also dramatically changed our approach. And so it's at once a very outcome-oriented project and very process-based, in the sense that we wanted to make sure that what we were doing actually was relevant and appropriate from beginning to end. Next slide, please. And this shows how quickly and dramatically that the landscape around COVID-19 changed. So I just pulled this out as kind of just a sentence from the original proposal. And so I submitted it on February 19th, and so very late in the night on February 18th. At that point, there were just over 73,000 COVID-19 cases in 29 countries around the world. and with almost 2,000 attributed deaths. And so, you know, that was right at the point that we submitted the proposal. That's what the data showed us, and we all kind of knew intuitively that this thing was going to blow up, but we had no idea. And so remember, 73,000 cases, 29 countries, and almost 2,000 deaths. Now, if we fast forward 3 months later, next slide, please, we can see how dramatically. So it's gone from, you know, kind of a small number of cases to over 5 million cases. The deaths have gone from under 2,000 to almost 350,000. And so you can see on the right-hand side, kind of the exponential kind of curve that the total cases and the total deaths represents. And so I think we all recognize fundamentally, just kind of in a sense, how uncertain and how unknown this territory that we're all in is. And that's both been a challenge in terms of doing the research that we'll be talking about today, but also has represented a real opportunity to do things differently in innovative and creative ways, and really to highlight, and we'll be doing this over the next hour and a half, is to highlight just the incredible vitality and the resilience on the part of so many of these First Nations across the country as they respond to the unknown that's reflected even just in terms of these data. Next slide, please. And so the Advisory Council very early on in that first meeting said, and you know, again, reflecting back, things seem to be transitioning now, and there's more time for reflection, maybe at this point compared to 2 or 3 months ago. But at that point, they said, if we were going to do a job as researchers, as a group of researchers, that we had to focus on communication, and we need to kind of shift our focus away from documentation and from all of these kind of immersive kinds of activities that we'd anticipated, which very quickly were no longer possible anyway, because so many of the communities were in shutdown, and obviously we're caretaking everyone's health, kind of shifting to doing whatever we could to amplify those community and those First Nations voices. In part, that's a vertical process, and so to amplify the voices from the community up to the decision makers at the provincial and the federal level. And so that vertical back and forth, and to share information back the other way, and we'll talk about how we're doing that, for example, with the Kakaku videos. But beyond that, also a kind of a lateral kind of communication. So really doing what we can to help information flow from community to community, or from tribal council to tribal council. And so that's the multi-way emphasis on communication. But again, communication, we were told by the Advisory Council, should be our first priority. Next slide, please. And so one of the first things we did, obviously, is we had to kind of try to think about what it was, our vision, what we were going to do moving forward. And we all understand the power of logos. And so I think, Merle, you were going to speak to this logo, which was developed by Erica Daniels.
Okay, so this logo was drawn up by a member of Pegasus First Nation, and what it represents is, you can see in the picture that the coronavirus is on the kind of the bottom right-hand side of the screen, and then we have a braid of sweetgrass and the medicines that are going to cover the virus itself. And then we have the land, because at this time, a lot of the people, a lot of the First Nations people are going back to the land. And you see in the background, there's water, and you see the sun and the eagle, which are all symbols of a First Nations culture. And that's why we selected this, because of its symbolic nature regarding the spiritual aspect of the plants and the way they're used. And they're covering the virus. Okay, next slide.
Okay, and so I just want to say I'm actually also looking at some of the comments in the chats that's taking place, and I think it's fantastic that there's a lot of people joining us from all over Canada, and I think that's fantastic. But I wanted to talk a little bit about colonialism in Canada and keeping that in the back of our mind as we're moving forward on this particular research project and thinking about the trajectory of colonialism in Canada and the fact that it's been quite long-standing. We've had many policies and legislation kind of impacting and having and continuing to have a bearing on the way First Nations communities engage with and live day-to-day lives, either on reserve or off reserve. And so this is something that we're keeping in mind. Merle and I come from territories in Canada that are covered by a number of treaties, and for the number of treaties, there is a treaty right to health that's contained as part of the treaty understanding or misunderstanding, as the case may be at times. And, we're also kind of moving forward with this understanding and awareness that healthcare services and program isn't uniform across Canada, both for Canadians and for Indigenous peoples, but also between the communities themselves. Indigenous communities, First Nations communities, in northern parts of the country, in rural parts of the country, may not have the same access to services. And so again, it's a really diverse environment. And that's not to say that, folks in one part of the country may have, easier access, but we're just kind of moving forward with the understanding that there are, there's a diversity in the way that in the way communities are accessing healthcare services and programming across the country. Next slide. And with regard to some of the research, we're also keeping in mind some of the social and the political realities, looking at and keeping in mind some of the gaps that exist. Again, access to healthcare isn't uniform. Urban, rural, north, and remote, and even communities closer to the urban centers, face unique challenges. Of course, there's issues around jurisdiction, First Nations, provincial, federal government sort of issues that we are also kind of keeping in the back of our minds as we move forward. We're also, mindful about the responses and contexts of, responses to COVID. A little bit later on, we'll talk a little bit about some of the First Nations responses and look at some of the ways that communities have been proactive in their responses to COVID in particular. And with regard to COVID itself, it is exacerbating existing health conditions and some of those gaps that I mentioned a little bit earlier. So one of the interesting things I think that the research may point to is whether or not or how COVID stresses or can create or have stress on existing systems. So next slide.
Okay, so this is we did a little bit of research from the past, and we documented the epidemics. For example, smallpox was an epidemic that devastated Haida Nation, and the devastation was on people because of the water and migration they used at the time. It was used to transport workers as settlers. So the settlers brought in the smallpox, and it really impacted the First Nation communities living along the coast Next slide. And one of the things that we've been doing is we've been talking with the first with Indigenous peoples from across the country and the U.S. as well, and we videotaped some of these conversations that we have. And one of the conversations was with a member from the Navajo Nation, Sean Young, was going to talk briefly about the smallpox epidemic. Can you turn on the video?
So right now, Haida Gwaii, we took a pretty rough hit during the epidemics in the 19th century, especially 1862-ish with the smallpox epidemic. We roughly went from 25 to over 30,000 people from the late 1700s, early 19th century to roughly 400 to 600 in 75 years. So we experienced, like a lot of nations across the continent, we'd like to say Turtle Island, suffered at least 95% or more population loss in a short period of time.
The smallpox epidemic really impacted the Indigenous peoples across Canada and much of Turtle Island. There's pictures throughout the archives showing the impact on Indigenous peoples throughout their bodies, and some of the people are jumping into waters to try and relieve themselves. It was really horrifying to look at the pictures and do the past research on the impacts of the epidemics. Next slide. Tuberculosis seems to be ignored, but it's an epidemic that's still very much in the picture with First Nations and Indigenous peoples. They call this a disease, a poor man's disease, and this is the case for a lot of the First Nations people and Indigenous peoples. When I say First Nations peoples, because I'm referring to the nature of this project, which is with First Nations peoples. We got the letters of support from mainly First Nations organizations. So this Manitoba Sanatorium was in Ninette, and it was first, the sanatorium came into operation in 1910, and it's closed its doors in 1972. And a lot of the First Nations people went there, as well as the Inuit people coming from the Arctic communities. And many of the First Nations that went there to die, the Inuit people as well, they went there to die, they never made it back to their communities. And it was especially tragic for the Inuit communities because a lot of them went there and they never went back, and they were buried throughout the grounds in the region. And a lot of their relatives that they didn't know they died because no letters, no communications were sent out to them. And we talked to Dave Scott from Swan Lake, which is in the next slide. Can you turn on the
Back
video?
in those days, Indian Affairs didn't send bodies back from where they were sent from, and a lot of Inuit people were sent down here in the south where they came to die because of TB and the horrible things that those sanatoriums did on Indian people before they treated white people. So they practiced or experimented on them. Those are the things that sanatoriums hide. The other thing was they would not inform family members when a member died. it was only through spying and watching those sanatoriums. We have one just down the road from us at Ninette, where a lot of people have died. And it was only because somebody seen somebody being buried that our people went and got them. They dug them up at night and brought them here to the reserve and reburied them here. So those are things that have happened. Again, you have to do this behind the backs of government people. You know, we didn't have the ability to deal with our dead. And even those that did not come from this area, we took anyway because of our belief system, our traditional beliefs, starting at human being, period. No matter where they come from. They were our people, they were human beings that were not able to go back to their own community. So we took them in. Other reserves did as well.
So TB is still a disease that's ongoing today, and it's an epidemic, and it's brought on so because of the conditions in the First Nations communities and the environment, the determinants of a First Nations health because of a crowding in the homes, the lack of services in a lot of communities. Excuse me. The list goes on, and the lack of services. For example, there's no medical doctors. They don't have a proper services and the equipment. They don't have hospitals, and many of the communities are very isolated. For example, in Manitoba, they don't have a road access. It means that when a person gets sick, they can't go to a hospital. To go to a hospital, it takes them a little bit more longer. For example, maybe one day to get to a hospital, and they have to fly out during the summer, and during the winter they have winter roads that they can access. But these are the realities of a lot of the First Nations. They don't have a cell service as well. Which means that the things we take for granted, cellular service, that they don't have that. If they have to contact someone, a lot of times they can't do it. And the services are just not there. And the services that we take for advantage here in the South, for example, the Wi-Fi, the internet, a lot of these services that don't exist in these communities. Next. The 1918 Spanish flu was another epidemic that really impacted the First Nations communities. When I talked to my community, the elders of my community, they talked about the Spanish flu. For example, in Lake St. Martin, when I was talking to the elders, they talked about they had a pandemic of plants in those days, but they didn't call them pandemics. They knew what to do to assist one another during a crisis. We call this kimbike, in my language, which means that the community gets together to assist one another during a crisis. And the elders talk about they had one person assigned that would carry the bodies to a mass grave. And that's all this person did was carry bodies to a mass grave. And a lot of times, a lot of these communities, they had their own planning in place because they knew what to do, and they knew what to do. And when a crisis came along, it wasn't the first crisis that they dealt with. They dealt with other crises as well. The Spanish flu was an epidemic that was unlike any other kind. And it came in 3 waves in the spring and fall of 1918 and in the winter of 1919. and it killed 20 million people worldwide. And there's a lot of pictures that are out there showing what happened during this time. People were wearing face masks. That's just the way people are today. And the similarities are there because for COVID-19, they're saying that it's going to come in waves, that this is the first wave. But knock on wood, it's going to end. You know, I have hopes, you know, we all have hopes, but we have to take measures to prevent the spread of it. And for First Nations, like I said, they're dealing with the situations right now that makes it more difficult for them to deal with COVID-19 because of the remoteness of the access to the healthcare services and the underlying chronic conditions they may have. For example, they may have diabetes, they may have a respiratory problem. So these are all conditions that make them more susceptible to this virus, COVID-19. Next. The 2009 H1 influenza was another pandemic that really hit the Northern Manitoba First Nations hard. Probably most of you heard in the news that that two First Nations communities in the Northern Manitoba were sent in body bags when they asked for assistance. So they asked for assistance to get face masks, hand sanitizers. This is a picture of the body bags that were sent to them, and there was outrage by the First Nation leaders that they wanted to know why the government sent body bags. And Chief J. Knott at the time, we had asked for funding so we can get organized and to ensure medicines, hand sanitizers, and prevent the kits were in place, but instead we were shocked to receive body bags. So this when the First Nations people are in crisis, they want to be able to help themselves. They want to develop their own pandemic plans, and to develop a pandemic plans, they need a little bit of assistance from the government, because they're developing pandemic plans to get ready for emergencies. So they go a long way up. They need to be ensured that they have the resources in place, they have the proper staff, the numbers, the contact persons, et cetera, and this is what the First Nations had asked for, just a little bit of resources to develop these plans, but they got the body bags instead. Okay, next. So now we're dealing with a COVID-19 now, which is a pandemic, a global pandemic, and we have experiences from past pandemics that we can bring forward to us in order to deal with this new pandemic. Next. There's a lot of countermeasures are being developed by the First Nations people. Social distancing. They have a social distancing countermeasures in place. Road blockades, checkpoints, suspending services to the territories. Going back to their traditional medicines and the land. And I'm going to talk about each one of these, starting in the next slide. Next slide. One of the things that I've been thinking about regarding the countermeasures that First Nations people are taking. We have a countermeasures. For example, this was for my community, Lakes Martin. We have a checkpoint where there's a security in place where they ask people coming in whether or not that they're from the community, and they go by a ban list and they check whether or not you belong and when you belong in the community. If you're not, they're not allowed to go in. And this is like a past system, and the way it was done before with the Indian Act, where First Nations were not allowed to leave the community, but now it's reversed. First Nations people themselves are the ones enforcing the past system. And before it was the Indian agent that was enforcing the past system, where First Nations people were not allowed to leave the community without the pass, and now it's reversed. It's First Nations are not allowing people to enter the community if they're not a member. Okay, next. Another thing First Nations people are doing when they're asserting their sovereignty. This is a picture of the Gaga Cree Nation. When they have a road blockades preventing a Manitoba High to workers from changing shifts. This is in northern Manitoba. These workers were working on the kiosk project, which Manitoba Hydro is building another dam. And the reason that they put up these blockades were to restrict the workers from coming in from the south into the north, because a lot of times they're the ones that are coming into the new territories and bring the diseases with them, and they don't show any symptoms until a couple of weeks later. So this is a picture showing the blockade, and the one on the right was a view showing the blockade, a peaceful blockade at that. Next. Right now, we don't have any cases in First Nation communities in Manitoba. This is located. This message is located on number 6 provincial highway near St. Martin Junction. And the government of Manitoba, together with First Nations organization and other communities, non-First Nation communities, put up this this restriction on the number 6 highway that our non-essential vehicles would not be allowed to go past the 53rd parallel. So the blockade was put in place and it was enforced. And the Manitoba Kuwait organization put out a press release saying, and they supported this because these are the countermeasures that work. They prevent the spread of the disease. When we look at the stats across Canada and Manitoba for the First Nations, like I said, we don't have confirmed cases yet for the First Nation communities in Manitoba, so we must be doing something right. Okay, next. And another countermeasure First Nations are taking is they're developing their own traditional medicines. This was taken in St. Teresa Point First Nation, and other people out there made their own medicines using the traditional plants or the plants that are growing within their communities and within their territories. And this is a proactive measure, because that's the way First Nations people, Indigenous peoples, have dealt with diseases in the past. They went to the land and extracted medicines from the plants around them, what was around them. And a lot of First Nations people are going back. When I say going back, they're going back physically into the land, into the bush, to clear their minds, because around them, that's where they have the smell of nature. The cedars, the trees, you know, the air around them emits the medicine that they need. Okay, next. We were in conversation with the Navajo Nation as well. When we talked to one of the members there back in March. As you know, the Navajo Nation has one of the most highest cases of COVID amongst Indigenous peoples, and they're located in 4 states, Arizona, New Mexico, I forget, but anyway, so we talked to this man, and he talked about what they're doing to get the message out to their people. They have a very larger territory, and the people in that territory experience the same things we do in a lot of our communities. They don't have access to Wi-Fi, they don't have telephones. So the challenge that they're facing is the communication aspect of communicating the seriousness of COVID-19 to their people. And this is a video. Can you turn it on?
And I think that if we could just take the time and go out to our grandmas, grandpas, those ones that don't really have the technology that we have, you know, our computer phones, or, you know, for us, we're on this every single day, you know, almost every single minute, checking Facebook and emails and stuff like that, you know. But for them, they have nothing. The only means that they probably have is radio, you know. And I know that the radio is the only means that our president has been on. And I think even then, I think it needs to be explained a little bit deeper for them to, just like last night, they had a quorum on our Navajo Nation radio, which reaches 400,000 people, you know, 500,000 people. But if it's explained in Navajo at an elderly level, you know, not just throw it out there, but at an elderly level, and said, this is what's happening, I think that's might be the only way to reach them.
Okay, so the communication is a different for First Nations. They're being very proactive. They're developing different countermeasures in order to get to the message, across. Next.
Okay, so in that regard, I mean, so not only was our advisory council telling us that the communication had been a first priority, but a lot of the stories, for example, those from Ron Harvey down in in Navajo Nation and others, when we were reaching out, were saying that this was a systemic problem. And so what we did is we kind of began a number of different initiatives to help amplify those voices and to document, but also to play that role, whatever role we could play in terms of advocacy of support. This is a screenshot from our website. And so down at the bottom, you can see COVID-19 indigenous.ca is the URL. And so in that regard, we decided pretty early on that we needed to have some presence on the internet. And so we fast-tracked the development of this website. And in a sense, it provides us an opportunity to feature a lot of our activities and to feature those community voices. And so you can see here, and I'll kind of get back to this in a second, but we've been actively reaching out and trying to encourage people to share those stories with us so that we can in turn kind of make them more visible on our website. Next slide, please. One of the things that we did as part of our research team was to start documenting the cases kind of that were affecting initially First Nations and then Inuit communities and Métis communities across the country. And again, most of our focus is on First Nation here. And so this was not being documented in any explicit way that we could find. In fact, Indigenous Services Canada was kind of explicitly refusing to identify where those cases were. And so again, back to our advisory council, community health directors were saying that they were frustrated because they were finding there was a 2 or 3 week lag in terms of even finding information for their own community, much less what was taking place in the surrounding region. And so a number of folks on our research team, and obviously it's not just the 3 of us, there are many, many others kind of on the team, have been going and looking through Facebook pages and doing whatever they can to pull those kinds of stories of cases within the communities, and especially confirmed cases, and making them available. And so on our website, you can kind of click, you can see at a snapshot what's taking place across the country. Again, Manitoba is notable, I think, in the middle. Part of that is circumstance, and that we're kind of a flyover province in many ways, and people don't often choose to go to Manitoba, especially with all of these travel restrictions in place. But as we're saying, a lot of this is very much the proactive responses, especially on the part of the First Nations. Next slide, please. And so then what you can do is these are the kinds of data that are on here. And what you can do, in the previous slide, you saw those little dots. If you zoom in on an individual province, you can click on it, and then there's a link to the Facebook posting or the media story that indicates what's taking place in that First Nation, the date at which kind of that was located, has a link to the story itself, as well as obviously the numbers that have been pulled from the story. And so it's something obviously we are hoping that kind of people from across the country can make use of in ways. And if we have things that are wrong or things that need to be updated, then of course reaching out to us and letting us know would be really, really important. And so, but again, it's that idea that we're kind of grounded in Manitoba, but we're doing whatever we can to reach out to other parts of the province in terms of amplifying those voices. And then what you see here is a kind of a cumulative number of cases over time. And so I don't know if you can see this, but kind of the latest time that this was updated was just a couple of days ago. And so next slide, please. Also, having a Facebook presence is crucial. And so as most people who are here with us today, I'm sure know that Facebook is absolutely essential for Northern communities, especially, but communities across the country to share and to network with one another, especially with all of the physical and the social distancing. Ironically, neither Ramona nor I are active Facebook users, and so, but Merle definitely is, and so many people in our research team are, and so we decided ahead of time that we needed to have a presence, Originally, it's kind of evolved, and we'll talk about that in a second. Originally, we were just kind of reposting other people's stories and other people's posts and et cetera, and especially news stories. And as we've come online over the last month, we're doing more and more of our own content. And so in a sense, it's become really valuable as a way of networking, especially around the Kakaki videos that Ramon is going to talk about in a second. And you can see the URL and the link down below in terms of that, or just do a search under COVID-19 Indigenous. Next slide, please. And so, Kakaki.
Yeah, so one of the initiatives that we've been working on most recently, and is maybe one of those real-time data sharing tools that we're creating and working with actively, is a project we called Gaga Straight Talk. So some of you may have seen it, some may have not seen it, but really it's a collaborative approach to getting culturally relevant and culturally informed messaging in the Cree language to community people. And so this is, again, it's a collaborative approach. We've got folks from our team who work quite closely with our puppeteer, not our puppeteer, but the puppeteer who has agreed to work with us, named Samson. He's from mithwayawin, which is the community that I come from. We also work with knowledge keepers who help us with translation. And so we've got a videographer that we work with quite closely, and then some of the co-leads are working together to help kind of shape what each of these episodes become. This particular element or project really focuses on the importance of language, and I think it is our attempt to implement maybe some of what Ron Harvey talked about in that earlier clip about, incorporating messages to community people that will resonate at the community level. And so we attempted to, and it deliberately, to create this space, this cultural and this linguistic space that would allow us to help communicate some of the health messaging in Cree language. We've now dubbed one of these earlier videos into the Dene language, and now we're working on doing a similar approach with Anishinaabe. And so, it's still a work in progress for sure. Can we see the next slide, please? And so we've done a few of them now. CBC did a nice story on this particular aspect of the project. And so if you're interested, there will be links posted to the Gaga videos for sure on our website, but I do believe they're also being housed in IRSI's website as well. Can you move to the next slide, please? And you may need to play it.
Kitatipithitamak coronavirus agusuin matsi China Countermeasures kimagag. Meduisigaron tipa madalitue. Timoda ista tuita. Kaito. Hatem. Tatsi tita manila agusin. Wow na itin. Ga. Mana ilagi tagusin. Ha. Mana gutsi tamagin agusin apampatik. Matsi tan sanitizer tiga patsitain agat kapita kasititin. Apo tayo naman ikiwan ni tagastig ani mga kusuin. Agat tatit tayo naman ikikut kituna po kiskisig. Kagigatsit nini. Piyagon itsagat tamuin kahit tamatsun. Away gagoyes tagi pagitat tamuin. Kigasit sitarona. Ako asay kigas ni swami tatamit tanawaskia. Katsit na makumido ako siwin. Matsi no to ni tosik misit witsiga pa istoatse awina kagia suik. Aga wipat ya suipadik. Kaustustutag awina apo kayodimut kagia suik. Ay. You got any Kentucky Fried Rabbit? Bird. They're killing my cousins. Wait! What a answer does it take it down on, huh?
What's it way?
Get him, Get down on that. Take him, kami na tagiga si kape. Itagi naman yung tagitsis naman. Kiti at isak puta ko siya kumawats tagigatsit na magumido awat taginip pa ikutsik. Kasi sitsik mistay agwa kaudan nas ayaw nakakusit. Kita sita ko tabasan. Itip kami wait na mga itinyak na kasi sitsik. Watan nila kasi sitsik. Watan nagipit si punita. Kapoy wali nung sitan. Wichituttan ta wikipit na mago makusuin. Ikusi, nganti pa pamidanira. Sabi mispol, mani di pamidan. Wapagi.
Okay, so that's just an example of one of the videos that we're putting together. And so this was one of the earliest videos that we did. Again, the idea behind this is to provide an opportunity where we can share some real-time information with folks in the community. And again, this is with the acknowledgement that not all First Nations people speak English. And we've attempted to incorporate some of the humor that the puppeteer, creates in these clips. So Gaga was a pre-existing kind of character, and we had approached the puppeteer to see if he would be interested in working with us to develop some of these clips, and thankfully he agreed to participate. And so we've been working closely with him. We're working on a clip that's going to focus on elders. Again, there's additional information there if you're interested in viewing these. And again, we're sort of in the process now of translating them into Dene, into Anishinaabe. So yeah, this is a work in progress. And in terms of the short, medium, and long-term goals, this is probably one of the more short-term goals that we're looking at in terms of the real-time ways that we might be able to help get some of the health messaging into the community. Next slide, please. And if you're interested, again, you can find these links on the website or on the actual Facebook page. And I do believe that there are ways that you can find this information through the host website. Next slide, please.
So maybe I can do this one a little bit. So just following up. So in total, right, Ramona, there's been probably over 35,000 views on the first 3 videos as well. And so there's been real uptake from across the country. And what's especially interesting is if you track and see who's liked it, it's lots of folks from the north across the country, and we're getting lots of great feedback. And so it's really kind of taken off. I would say also it's been featured around the world, in part because of the CBC Story, and I think maybe in part too because it's a positive, and it's a hopeful, it's humorous, it's funny, and so in a sense it's resonated with people around the world, and so it's great. So in part of this, I mean, obviously we're kind of shifting from this very immersive community kind of, in a sense, kind of emic approach we were going to take around the research, and we just realized that most of these communities would no longer be able to visit, much less work with, kind of in kind of actually visiting. And so we had to do something else very, very different. And so obviously, like the rest of society, we're switching over to video conferencing. And so what we realized is that that represented all sorts of barriers themselves. And so so what we decided is that the use of infographics would be kind of a more compelling, engaging way of providing support, just whether it's speeding up the internet infographic on one side, or even something like how to use Zoom. I mean, we're all participating by Zoom today, and it's something that's become second nature for many of us, but there are huge barriers to folks who have kind of inadequate bandwidth or kind of old technology. Most cases, as everyone knows here today, communities won't have often access to computers, and they might be old phones. And so a lot of our first infographics were kinds of, in a sense, providing supports to allow us to better engage and to really amplify those voices that we've been talking about. And then if you go to the next slide, you'll see some of our subsequent infographics that we've been doing.
Okay,
No.
Okay, go ahead.
Go ahead, Ramona.
I was just going to say that with regard to the infographics, in the same way that we're taking the approach to the Gaga videos, there is, you know, we were trying to incorporate culturally relevant messaging, and again, you know, aiming to create some of these infographics that will reach an Indigenous audience, you know, in using those culturally meaningful and culturally informed processes. You can move to the next slide. Okay, Steph, you want to speak to this one? Oh, your mic.
Sorry, did you want, it all breaks down here. Merle, did you want to speak to the Sabe one before we go to the next slide in terms of, again, what that character is? And
so Sabe means man in Anishinaabe, but not the biological man, kind of the patriarchal, I guess. And we associate Sabe with this a creature that lives alone, and he doesn't associate with anybody, and he only comes out, like it says, when he needs anything. And there's a lot of stories around Sabe, and for those of you that may know him as Bigfoot, Sasquatch. So this is an infographic based around that we have to be like him. Like Ramona said, we have to be like him. We have to be isolated, and we have to keep to ourselves during this time. Okay, next. We're going to speak about this, Steph? Or...
Okay, or remote. I guess we can all do it, right? So in this case, one of the things obviously was an emphasis on caring often isn't sharing, and so it's anti-intuitive. And as Merle and Ramona can definitely speak to, it's something which is counterintuitive culturally, especially for First Nations, which are so close and so socially engaged with one another. And so kind of we went through this process where the original kinds of the original infographic was kind of more urban centered and had urban kind of symbols, and so we tried to figure out ways of making them more inclusive, so that in a sense, rather than just having a takeaway cup, it was kind of the cans and pops and you know, the bottled pop here that you can see, obviously also highlighting kind of not sharing smokes and things, again, in ways that are compelling and of interest to people. And it's been very interesting that I was just speaking to one of the leads, if you like, behind the infographic. And so she was looking at the Facebook analytics, so the stats, and so these are being shared thousands of times by, and in a sense, people are finding value, not only just looking at it themselves, but sharing it with one another. And so, again, not sure if Merle or Ramona want to speak to that, but just this idea by using these very simple kind of constructs that we can potentially have an impact in the, not in it's quite as high visible as a way as the Kakaku videos, but at least in a complementary way. We can move forward to the next slide, I guess. Another one of our initiatives, again, as you saw in that original screenshot of our website, is really kind of encouraging people to share their stories, whether it's text, whether it's video, whether it's photographs, and doing it as inclusive a way as possible. And you know, we have these little draws that kind of everyone who enters something is automatically kind of registered to win a kind of $100, if you like, and we do these on a monthly basis. Again, just as a way of encouraging people and affirming those experiences, and as a way of kind of shifting those voices just from our primary and existing networks to include other people that we may not know from other communities that we may not have reached out to before. And so we're just getting going on this, and again, hopefully we can be in a position that we can share hundreds and hundreds of these stories at some point, which are firmly grounded, embedded in First Nations across the country. Next slide, please. Another recent kind of initiative that we undertook, which is parallel to this one that we're all part of today with IRSI, is a webinar. And so we've come up with a series of webinars, and the first one was on land-based education. And it's interesting, we were kind of reflecting on this in the meeting this morning, but you know, there's also kind of maybe this situation that's taking place now, that maybe some people are getting tired of the COVID-19 only kinds of stories. And so we're kind of trying to diversify the content. And of course, a subtext for all of these is COVID-19 and people just naturally speaking about it. But in this case, our first one, kind of that we launched, which was just a couple of weeks ago, was on land-based education. And so we had Alex Wilson from University of Saskatchewan, who's from northern Manitoba, kind of a Cree community there, plus we got Cree Nation, Nikki Ferland, who's Métis, and Taylor and Dylan, who we work with at the University of Manitoba. And so they, in a sense, all spoke to this, and Taylor and Dylan are both First Nation as well. And it was kind of hosted by Michelle Daou, the first episode at least. And if you go to the next slide, please. I've just pulled out a little clip from this, but it's being viewed, as you can see here, over 1,400 times in terms of the original. And again, this was our first one. Almost 1,000 people participated live, and it was really successful in a way that we hadn't anticipated. And so if you can just play, I've just got a little clip here from Michelle interacting also with Omar and Crystal, who were also participating from a Pasquiat Cree Nation.
Communities that are hydro impacted, how do you find that land-based education really connects that or translate into that land defense?
When I started to right now, can you hear me? You're well. All right, we're good to go. Okay, what I was going to say is that right now we're dealing with a dead land because we're stuck in between two hydro dams. A lot of our habitat is gone, like our moose habitat. So the populations have dropped. We have muskrats that have also moved out or died from a disease or whatnot. So a lot of the land we're dealing with right now is dead. And that's something that from now with our students, they're not able to see what I've seen when I was at that age. So it's just trying to paint the picture for them. Tell them how important it is for water stewardship, how important it is to fight for your territory, how to look at whatnot. even though these corporate companies like Manitoba Hydro, they give you the incentive, but the catch-22 is be careful what they're doing because we're dealing with a dead land.
And so in a sense, even though it was land-based education, even though we're talking about kind of advocacy and Aboriginal and treaty rights and kind of, in a sense, resisting the impacts of industry, it was also kind of bringing implicitly COVID-19. And so some of what people were sharing is what they were doing in the context of COVID-19, not being able to go out on the land as readily. And so if we go to the next slide.
Home communities that are hydro.
No, sorry. Yeah. The next one's going to be on Indigenous food sovereignty. Many of you know will know Don Morrison, who's out here in BC and is a long-term proponent of that. Asfia Kamal from the University of Saskatchewan, Priscilla Satie, who's from the University of Saskatchewan again, and Tabitha Martins, who's a PhD candidate out here in Manitoba. And so they'll all be speaking around that. And so that's actually on Thursday. And then we have others that are coming up around quote unquote man camps and hydro and other industry camps around gender and violence, traditional foods, traditional medicines around COVID-19. And so there's a wide diversity of kind of topics and speakers. And again, we're especially trying to highlight those Indigenous voices whenever we can. Next slide, please. Another interesting initiative that we're kind of that's really come out. Taylor Galvin here, who is kind of a coordinator of our Kiskin Hamakawin project, which is a land-based initiative in terms of kind of bringing science and Indigenous cultures around land-based education. And Taylor actually spoke in the first webinar that I was just talking about. But and so people have been involved across Manitoba and Ontario with that program in terms of communities. But Taylor has a long history of working around radio, and so she had this idea of doing a podcast that would highlight a lot of these issues. And again, just as another complementary way of kind of highlighting these Indigenous voices. And I would kind of, you've kind of got a number of screenshots here that I've got around Akiwan, which is her program. And I just have a little kind of a clip here that I've taken from her second episode, which really kind of focus on kind of relationships with the environment, Indigenous communities, and in a sense how COVID-19 seems to be benefiting and the environment indirectly. And so if you could just play that, that would be great.
I can't speak for the world, but I can send prayers to the Star people, Creator, our ancestors, that we learn from our old, in quotations, normal ways. No matter how hard it is to be an environmentalist in a capitalist society, we as Indigenous people know the value of Aki, Nebe, Ishkode, which is the land, the water, the fire, our 4 and 2-legged relatives, our Mother Earth, Grandfather Sun, Grandmother Moon, and so much more. Now, though it seems very easy to think positively as environmentalists and land guardians and water protectors, that all these environmental changes are happening because of COVID, and we're seeing all these levels declining in pollution and emissions. It is not something that needs to be celebrated, though. Some people are losing their lives due to the COVID pandemic, and the sad reality is that these environmental impacts are needed, but at what cost?
Sorry, Steph, you seem to be muted again.
Mute again. And so Taylor has been a really kind of effective proponent of using radio. As we all know, many of these communities are linked up north through radio. And so there are a number of initiatives that we're getting going on that. Next slide, please.
Speak for the.
And so part of what we're doing, we're obviously being right immersed in the middle of it. And so one of the things that we're trying to do is to figure out now is trying to make sense of all these different initiatives. And so what we've got here, so my dog is barking in the background. What we've got is kind of different scales. So from the community all the way up to the international scales. And then we've kind of got what I saw as being four main kinds of threads of initiatives. So around communication, around advocacy, around documentation in terms of the present, and as Merle was speaking to, documentation in terms of past experiences. And then if you like, there's these four themes that are associated with those. And so justice is a combination of advocacy and then learning from the past. Truth is documenting both the past and the present as we move forward here or to the kind of around the circle. Understanding is communication and in terms of the present and reaching out and trying to further that. And then potentially even reconciliation in terms of linking communication and advocacy. The other thing that I did in terms of trying to summarize all of these different activities here was with these ridiculous little kind of squiggles that I drew was trying to kind of show what our emphasis has been. So say around advocacy, for example, is really primarily, if you look, there's that little green line there. And so it's primarily located on the provincial kind of, and potentially the federal kind of scale as well, not so much at the community, not so much internationally. We haven't done as much documentation as we move down here as we hope to moving forward. And again, that's been primarily at the regional, the provincial level. If you look in terms of the present documentation, again, what we focus on here is it happens at all scales, but less so in terms of the international and communication as indicated by this little red line. We've really tried to maximize it at all scales. And so in a sense, what we can see at one hand is a whole bunch of different things that are taking place, kind of a whole bunch of different initiatives around documentation and around communication and advocacy that our group is, in a sense, immersed in, but there's this kind of cohesive element to it as well. And so what we're doing as researchers, not only are we kind of furthering all of this action in the way that we've talked about, but we're also kind of learning and reflecting and documenting our kinds of own experiences and those that we collaborate with moving forward as researchers. Next slide, please. And so I think that's it for this. I don't know, Merle, if you wanted to kind of to wrap up, or Ramon, if you wanted to wrap up, and any final thoughts as we kind of shift to a more discussion-based aspect of the presentation.
Okay, I just want to thank those of you that are still on. I know that we went beyond our time, and we're approaching the 1.5 hour mark. But this is important information, I think, that will be used by communities, not just the First Nations, but for settler people as well. We tried to incorporate as much as we could in this a short period of time. This is a lot of information, but this is just a small piece of what we're doing, and we hope to connect again, maybe later sometime. I will get invited back on toward the midway of our process, or towards the end of it. But I wanted to say,
yeah, and I just wanted to say, I thank you, and we thank you for giving us this time to share some of this exciting research with you. Yeah, so it was great, and looking forward to see if anybody has any questions. But thank you very much for inviting us, and thank you so much for listening.
Awesome.
If we
Thank
go to
you.
the last slide, just obviously these are all our funders. I also just wanted to highlight the many people in terms of the research team, and there's 10 people that we work with. And again, I just want to thank people like Michelle and Taylor and Dylan and Emily and Michael and Hannah and Kelly and all sorts of people that we, in a sense, play all the incredible support role, as well as the innovation and the creation that you see here as well.
Absolutely. Yeah, thank you all very much. It's been really eye-opening. Just the kind of the scope and the variety of the work that you're doing to not only to kind of advocate, but also to bring us all together from a like you said, from a provincial, but also from a national context, bringing together Indigenous communities so that we can have a conversation about what is important to us, which is ultimately the health and safety of our communities during this time. So I've had a really great time. I just wanted to mention for everybody that was going to leave, the panelists have been generous enough with their time to say that they'd stay till about 11:45. So we're going to transition into a Q&A. If you have to go, you have to go. I can appreciate that. This video will be available over YouTube, along with any of the resources that we've mentioned, as is per usual. Anyone that registered for the event will be emailed those resources, so you won't need to go out and kind of try and search them down or take rapid notes on anything that we discuss here. It'll always be available for you. And a special shout out again to Ursi. Thank you so very much for helping us all kind of come together in this way. It's been really appreciated. And as is featured on your screen now, we have one more final upcoming webinar in the series covering COVID pandemic reporting in Indigenous context. It'll be on June the 4th, and we're excited for that one, and we hope that you will be able to join us there as well. So at this point, we're going to transition into the Q&A section. We do have a couple questions from our chat that have been kind of loaded up. And the first one was fairly early. It was from Spencer, and he asked a question about how are you connecting with and supporting members who are living in urban centers in particular? And I think, if I may, a lot of what seems to have been done on the online space would obviously be directly applicable to both rural and urban populations, of course. But I think the heart of Spencer's question is, do you have any specific kind of initiatives or thoughts on how to support those Indigenous populations that may not be directly living with their communities?
Maybe I can take a lead. I think we decided pretty early on that we needed to, because it's such a wide-ranging project, as you were saying, Cole, that we needed some kind of focus. And so we decided we would focus mostly on First Nations and mostly kind of in communities themselves. Obviously, the need is huge in terms of an urban Indigenous context, but that has not been our focus thus far. That said, Merle and I were just chatting with a student yesterday who has a project which will be reaching out directly to urban communities, and so we were talking about ways that we could support one another and enable one another's projects without actually taking too much on. So it's finding that balancing role. But Merle and Ramona, you probably have some things to say about that too.
I can speak to that. Like Steph said, a lot of the support came from the First Nations communities when we solicited the support before we started, and that doesn't mean that First Nations people living in urban centers can't be a part of that, because they're registered with a lot of their communities. And I think to be inclusive, if they wanted to be part of that, they could be part of the study as well.
Great. Ramona, did you have anything you wanted to add?
Nope, I think they've covered it.
They knocked it out of the park. First one down. Okay, so we have another question here, which is kind of more big picture, and I'd like to hear, some different perspectives from all three of you. But how do you foresee the process of reopening communities? How do you see that that kind of going out? We've talked a lot about kind of communities closing off and self-isolating for the safety of their members, right? But yeah, how do you foresee that process happening, or what would you like to see?
I can start. My community of Lakes and Martin, like I said, there's a picture that I showed there right from the start, the social distancing and the blockade. I think for the communities to start reopening, the community members themselves need to identify and concur with one another that they have it under control. And it's up to them to reopen, and nobody can force them to reopen. It has to be the community members themselves and the leadership to confirm indeed that they are safe, that they don't have any people with the virus, and that they did what they could to take effective countermeasures and to be proactive.
And in terms of kind of moving forward from here, I think that as individuals, we all need to do our own part and sort of acknowledge our presence in public spaces. There are communities that are slowly starting to open up now. It's about, I think part of the process needs to involve sort of that sustained communication about ways that folks can be proactive in their day-to-day comings and goings, and sort of being, again, just mindful of the space that you occupy in that broader public space. Through Gaga, you were trying to sort of remind folks that, as restrictions become slowly eased, we need to just, again, be mindful of how we're moving about in those spaces, and, sharing messaging around how, things to watch out for, and really not to let your guard down. Just because, things are sort of slowly starting to open up doesn't mean we can let our guard down. As individuals, I think we still also have to be mindful of how we move. So.
Right.
And I just wanted to quickly add that obviously what we've done in terms of as a society, a broader society, in terms of the individual communities that we've been talking to and talking about, is that kind of, in a sense, shutting down, right? And so now as we move forward, there's something that needs to be more nuanced. And so it's more in the gray. How much do you open? How, is it too much? Is it too little? How do you adapt to new situations in the fall, or if there is a second wave? And so one of the initiatives that we're just kind of, in a sense, starting to go on, and which we hope to kind of unfold in the next few months, is in terms of providing kind of real-time data or ongoing data to communities so that they can make those informed decisions themselves. Because as we kind of started the conversation here today, is that there's this absence of data often, and certainly in terms of medical data and health data, in part because the governments aren't kind of finding ways to adequately share that. And so if we can be part of a solution that enables communities to, in a sense, to collect and to make sense of the data that they've got in terms of what's taking place within their communities, then they'll be in a better position to be more nuanced. And so what they can do is say, well, this is what's taking place in our community, and it might be different from another community in the same province or a different part of the country. And so again, shifting away from open or shut kinds of dichotomies to kind of these blended responses, which is perhaps a mix of the both. And that's the role that we can play as researchers, is to help facilitate the collection and making sense of those data, ideally almost in real time, so that we can turn around and make that available to communities, with communities.
Yeah, that sounds wonderful. I think, and I 100% agree. I think that, you know, kind of, if I may just kind of summarize what I'm hearing a little bit, is that the provision of this data is a goal of the team, and that thereby in so doing, you give the tools to make community-specific reopening plans, action plans, if you were, for those individuals. Ultimately, the health and safety and the knowledge around what's going to preserve that health and safety is with those community members, is with their own leadership. So I really appreciate that. We have a follow-up question that says, what should communities consider when creating their own evaluation plan? And it's pretty related, so I just wanted to open the floor if there's anything specific that any of you wanted to mention that communities should look to, or perhaps resources that they can look to if they feel like at a bit of a loss.
I think we're all pointing at Merle here, who has a lot of the experience.
I think for communities of people to do their evaluation plans, are you saying pandemic plans, emergency plans, or whatever the case is, they need to go by the resources of what they have. And sometimes you can start planning without money, because there's a lot of resources that are out there that First Nations, Indigenous people can access or tap into. They have resources with their own community members. So like I said, I gave an example of what my community did during the Spanish flu. They got together, Kimbike, Oakland, said that that's a term we have when people get together during an emergency or a crisis. And they started delegating people to do specific actions, and that's what's needed. There's a lot of First Nation people taking proactive measures, countermeasures, and they're developing their own without waiting for the government to tell them what to do. And I think that's what needs to be done, and that's the only way they can bring down the numbers. So, like for example, Manitoba, we have 0 right now within First Nation communities, and we want to keep it like that.
Yeah, of course. I mean, those are fantastic numbers. Kind of no matter how you look at it, that's amazing. And yeah, we'd be looking to do that. And I think, as you mentioned throughout the presentation, that's mostly a symptom of the preemptive action that's been taken by communities in Manitoba, right? So that's fantastic. So we have probably time for one more question. I apologize to everybody that we haven't been able to get to your questions. So I'm going to lead with one that's a little bit focused more on your research study again, and that is around not just urban populations, but the homeless population for First Nations. Do you have any specific ideas or plans to engage that population in your research moving forward?
Again, that I don't think will be the focus of what we do. And again, there was another comment there about populations that are incarcerated at the provincial and federal level, and absolutely, and we all know that the huge majority, in Manitoba, 88-89% of the population in our prisons are Indigenous, and it's critical. But I don't think we'll ever be in a situation that we can play the lead in doing that. But certainly what we've been doing through our Facebook, for example, is as those stories come up in terms of homeless and Indigenous people, or Indigenous people who are in prisons, primarily across Canada, but sometimes, in other parts of the world, then we'll highlight those and we'll make them available. And so we try to amplify those stories. Certainly in terms of the networks that we're creating, in terms of some of the connections we have with decision makers and say politicians, especially at the federal level through our project, then we would absolutely be happy to play whatever support role if people reached out to us to be advocates and to be, in a sense, companion travelers around that in terms of getting governments at whatever level to be responsive and to be accountable around those obviously important issues. But I don't know if we'll ever be able to play that lead role at this point, just because we've taken so much on. And again, because our approach is very process-based, while also being outcome-based, it takes us longer than if we were just not reaching out and not kind of checking in with all of our partners. And so the fact that our process is accountability and transparency-based means that things often take longer than they would otherwise. But just to summarize by saying that we would absolutely play kind of a support role in that if people reached out to us and wanted us to be part of that without it being our full focus.
Merle or Ramona, do you have anything to add? Or
Yeah, I can add to that. When we talk about homeless population, we have to realize that there's a lot of homeless population members that live in First Nation communities, but these numbers are not documented. There's people that are homeless, but they don't live on the streets but they live in other people's homes for one night and move on to the next relative, and that's the way we deal with that. Because we have because of our culture, we tend to take people we know in that require a place to spend the night, and that's the way we deal with that. So for those numbers, we don't call them homeless, so we call them something else.
yeah, that's a great point, and I think it's an indication again of where kind of Indigenous ways of knowing and of being is kind of comes up against kind of Western classification systems and the way that they can interact with academia and all that sort of stuff. So that's a really great point. Thank you, Merle. We are at 11:45, and I appreciate everyone's time here. Dr. Steph McLaughlin, Dr. Ramona Nekaway, Dr. Merle Ballard. I can't thank you enough for your time, for the presentation. I loved every second of it, and I hope that we can all kind of look to use this sort of network or sharing a place that you have created to stay connected to one another throughout kind of Indigenous communities across the country to support one another. So I appreciate very much your time once again, and to everyone that participated today, stayed right to the end to listen to all the Q&A. Thank you very much. And we look forward to connecting again. At this point, I think we'll say goodbye.
Thank you. Goodbye, everyone.
Bye.
Bye.